and here we are going to discuss the Neetpg 2022 anatomy recalls, and you might get uh, all question of anatomy which is asked in the Neetpg. So the first question: female with the hard painless lump in the upper quadrant of the breast presented with the following clinical findings. Mechanism by which this occurs is. So here the mechanism, you all know this is the pudeo orange appearance, and in the cancer you can see the infiltration of the ligaments of Cooper, so there will be puckering of the skin here in the breast. Okay, and in the infiltration of the lacriniferous duct there is also seen here the swelling over the other part of breast, while in the obstruction of the subdermal lymphatics you can see the orange like appearance, and it is the it is called the pudeo orange appearance, and it is usually seen in the uh, painless lump of breast or the lung cancer. Okay, so answer here will be obstruction of subdermal lymphatics. Patient underwent varicose vein surgery wherein graft was taken from the structure in the femoral triangle, now complaining of the loss of sensation on the medial aspect of the leg. Now likely to be injured in this condition is. So the which nerves are present in the medial aspect of the leg? From the option, the sural nerve is present in the posterior aspect, femoral nerve is present in the thigh, and the obturator nerve is also present in the posterior surface of the leg, while the saphenous nerve is present in the medial surface of the leg, which is likely to be injured in this case. Identify this tissue. This tissue is mildly the hyaline cartilage. The fibrous cartilage shows the fibrous chondrocytes, and the articular cartilage shows the bony osteoblast, and the elastic cartilage shows the elastic fibers. Okay, so the answer here is the hyaline cartilage. Which of following is the most common sequela of the saccular aneurysm in the brain? So the usually saccular aneurysm means the round shape aneurysm in the brain, which is usually occurs at the subarachnoid space. So it is called the subarachnoid hemorrhage. So the answer here will be subarachnoid hemorrhage. Then which of the following is derived from the aeroid area? So this is the embryologic structure. Ventral mesoderm, this is ventral arrow is ventral mesoderm, this is ventral mesoderm, and this is dorsal mesoderm. So ventral mesoderm goes to the right side, and the dorsal mesoderm goes to the left side. Okay, so here the answer will be here the answer will be the parts which are present in the right portion. It will be the answer. So the lienorenal ligament means the spleen and the renal ligament, so it comes in the left side, and the gastrosplenic ligament joining the stomach and the spleen, which is comes in the left side, and the phrenicocolic ligament also comes in the left side. Okay, so the only the falciform ligament present in the right side with the liver, so the answer will be falciform ligament. Case of the toe gangrene with the importance, site of blockage in this condition is usually the okay, so it is the uppermost area of blockage, and the artery which is containing the major blood vessels and the containing the large vessels is usually blocked. So here the upper unilateral dorsalis pedis unilateral internal iliac artery and the femoropopliteal artery comes under the aortoiliac artery, and the largest vessel is the aortoiliac bifurcation. So the answer here will be aortoiliac bifurcation. And the newborn baby with the following condition. So what is the diagnosis? So this is the diagram we already discussed in the pedia portion, that this is the kidney bladder which is comes out of abdomen. It is not omphalocele because it is the round shape and contains the peritoneum over it, and not the gastrophysis and the umbilical hernia because it does not cover with the peritoneum. So it is answer is ectopia vesica. Then the elderly man presented to OPD with the drooping of the left angle of the mouth, inability to blow properly, and weakness of the muscle on the left side of face. Now in usually these muscles for the blowing of mouth, the buccinator, then the weakness of the left side of face, like zygomaticus, masseter, and all muscles are supplied by the facial nerve. So the answer here will be facial nerve. Okay. Also, there is a drooping of left side of angle of mouth is seen, and the dribbling of saliva is also seen, which involve the muscle supplying the facial nerve. So the answer will be facial nerve. And the patient presented to the ballistic movements of the arms. Area of the brain involvement. Okay, so patient presented with the ballistic movements of the arms, area of the brain movement. Usually the ballistic movements of the arms seen through the subthalamic nucleus. Okay, internal substantia nigra causes tremors and the tremors of the hands. Okay, and the internal capsule, which in Broadman area 44, it does not cause the ballistic movements. Okay, so the answer here will be subthalamic nucleus. Identify the tissue. So this is the histological pattern you can see in the diagram. In this you can see the lots of GI tissue, and which is not rounded shape. So, okay, the lymph nodes are usually present in the round shape with the granular structure. Okay, so no lymph nodes are seen in the diagram, and no debiluna is also seen. And if it is glomerulus, so there will be the podocytes and the and the glomerular parts, other glomerular parts are seen in the diagram, but there is no not present of any of the structure like endothelial membrane, Bowman capsule, and other parts are not present, so it is not the glomerulus. And the only option left is the islets of the Langerhans is seen in the GI tract. So the answer here will be islet of the Langerhans. And identify the bone. This is a simple basic question, but it also needs to think about it. So it is not a rounded shape and not the hammer type, so it is not the malleus. It is not the small bone, so it is not the stapes, and it is not the cochlea because it is the bone. So the answer here will be incus. You can see in the diagram this is incus articulation occurs in the malleus head. There is neck of malleus and the anterior process, lateral process, and the handle of malleus. Malleus articulation, short limb, body of incus, long limb, the base of stapes, posterior limb and the anterior limb and the head of stapes. Man came with pain at the floor of the mouth while eating and the subside after 2 hours. Swelling noted in the submandibular area. Imaging performed as shown below area. Likely diagnosis. So this is present in the lower part of floor of mouth and above the submandibular gland. So it is present in the submandibular glandular duct. It is not the osteoma because it is not present around the mandible, and not the artifact or the gingivitis. It is the submandibular glandular obstruction which is present as the stone. So it is called as the silolithiasis, and we already discussed this in our ENT recalls. Most common site for intraperitoneal abscess. First of all, we have to identify the spaces. This is the 1 number is the left phrenic space, 2 number is right phrenic space, and the 3 number is the right hepatic space, and the 4 number is the left hepatic space. So usually when the infection occurs, so abscess present in the Morrison's branch number 4. Okay, so answer here will be 4 in the supine position. And the route of metastasis of the prostate cancer to the lumbar vertebra. So usually the route of metastasis through prostatic through the prostatic venous plexus to the interiliac vessels. Okay, so the answer will be C. It is not transmitted through the transfilaric spread of the lymphatics or the lymphovesical vein. The patient undergoing treatment for the borderline tuberculoid leprosy present with the papular lesion on the forehead, nose and the extending to the bilateral cheeks with sensory involvement. Most common nerve affected is, so usually here the sensory nerve of the face is the trigeminal nerve, the facial nerve is the supplying pulse. So here the sensory part is affected, so the answer here will be trigeminal nerve. Okay. So here the completion of our INICT recall of the anatomy. I hope you will get knowledge from this, and if you like this video, so like it and subscribe my channel for the more Neetpg recalls, and share to your WhatsApp groups who have not watched this video.